Got me looking so crazy.
Oh boy, this week 50 Shades Darker, the sequel to 50 Shades of Grey, will be out in theaters. And if it does what the first movie did, it'll certainly get people talking, particularly about their sex lives. Of course, the whole 50 Shades thing, that is not for everyone. But our next guest says everyone can and should enjoy their intimate relationship, and it is definitely okay to ask for a little help along the way. So here to get the conversation, we get it started. We welcome Dr. Lisa from Wyzetta Cosmetic Surgery and Spa. Dr. Lisa, nice to see you.
Great to be here.
You know, sometimes too, you see promos for a movie like that, and then I think people get in their heads about these unrealistic expectations about what they're supposed to be achieving in the bedroom, right?
Absolutely, but you know, we all want to have the best experience possible,
Yes.
whether or not you're young or you're older, and there's lots of things that you can do to spice things up.
Okay, so
literally.
I like it. So natural levels of hormones for women in particular decline with age. So there's been this idea that, well, as you get older, that's just the way it goes. You say, no, that is not the way it needs to be.
There's lots of things that can happen. When in your 30s, your testosterone level starts to decline very slowly, imperceptibly, until your late 30s to early 40s. You feel like you woke up and all of a sudden you have a loss of libido, loss of interest, loss of arousal. And along with that, your body has changed as well. There's a little more flab and things are just a little different.
Okay. So it starts with the brain, though. So because we're going to talk about some of these different ways to fix those hormonal imbalances and things like that. But to get into the mindset that you want to be intimate with your partner is important. So what are some of your strategies? What are some of the things that women are trying to overcome, too?
Well, I agree. The brain is the most important sex organ that we all have, and especially women.
Yeah.
And there's lots of different things that we can do to actually stimulate that. One of the things that can be done is actually raising your testosterone levels with hormones. And we use bioidentical hormones in the form of a pellet to actually raise the testosterone, which is the hormone of desire, which can also then lead to increased arousal and sexual interest.
Okay, tell me about these different foods too that can kind of be fun to incorporate into your dinner or just your dates with your significant other that can be known as aphrodisiacs.
Well, these are the spices that I was referring to, the spices that can actually enhance your libido. They're considered aphrodisiacs. We have honey, avocado, figs, chocolate. Interestingly, honey has been a well-known aphrodisiac, and that is where the term honeymoon comes from.
Oh,
yes,
really?
Because couples used to drink some form of honey to actually increase their sexual arousal.
So as much as maybe you might go, okay, well, I'm not going to eat some cinnamon and automatically feel like it's time to jump in bed, but maybe there's like a little mindset of saying, let's share this little cinnamon dessert and then see what happens.
There is. Basil in particular was something that they would grind into a powder. Women would actually put that on their chest or on their body, and that was considered, again, to attract the men.
Okay, very cute. Now, let's talk about that other aspect of the brain, which is getting to know your partner and being in a really good, positive place with your partner and feeling in a safe place. Now, you have a cute way that you might be able to incorporate some fun into a date night.
My husband and I actually have done this. We've been married for 30 years, and after 30 years, you know, having a date night and asking each other questions starts to become very routine.
Because you kind of think, don't we know everything there is to know about each other? Yeah.
So we actually looked up online questions to ask your mate after you've been married for 5 years, 10 years, 20, 30, and we came up with this little way where you put the questions into a bowl, and each one of you gets to pick one out. And then you get to ask your mate those questions. This is an example, and this is a very mundane question. What was your favorite vacation as a kid? It's fun, and it's a great way to get to know each other once again after all these years. We spent a whole evening picking out different ones, and just like you get a fortune that you don't like, every once in a while you get a question and say, no, I don't like that.
Yeah.
I'll take a different one.
Yeah.
But it's a really fun way to spice up your evening, and you can do anything from ask these mundane questions to making up whatever questions you'd like to do.
Okay, that's really cute. So you kind of get those connections going, and then you mentioned the pellet therapy and the hormone replacement. So we want to show you an example of someone who's gone through that. Let's take a look at Danielle. She's in her 30s. She's never had children, but she sought out hormone replacement therapy. So Danielle is coming to join us at the table. Hi, Danielle.
Hi.
Nice to have you here.
Thank you.
Dr. Lisa, explain to us a little bit about what that hormone treatment and therapy meant for Danielle.
So again, Danielle is in her late 30s. She had declining testosterone levels and some of those symptoms of decreased libido, arousal, And we essentially balance the hormones by raising the testosterone, doing testosterone pellet therapy on her.
Okay, and Danielle, what did you think?
Yeah.
What's it been like for
Well,
you?
it's like when I hit my 30s, I just felt like it was harder to lose weight. I was fatigued, my sex drive was down, and I always thought that bioidentical hormone balancing was for like women who have had kids or going through like menopause. And I had no idea that everything I was feeling was totally natural, and women don't talk about it.
No, they're not talking
So
about it.
that's why I found Dr. Lisa and had my initial hormone levels tested and found out I was so low in testosterone, there was no way I could have felt normal.
Okay, so Dr. Lisa, I mean, I know that's hard for you to say statistically, but do you think there are a significant number of women who just think, like Danielle did, this is just the way that I am, or I'm just slowing down and getting tired, and there really is an easy solution?
The vast majority of women think that it is just the norm, and frankly, again, depending on the declining levels of testosterone, there's going to be variation in response. There's going to be some who don't notice it, but the vast majority are definitely going to notice a change in their desire, their arousal, their libido. And the good news is that there are options. There are ways to raise it beyond just basil on your chest and eating a little more honey.
When you mean the pellet therapy, then what do you mean? What are you doing?
So a pellet is very small. I brought one
Oh,
along
of course. She's
with.
got things in her
I've got a
pockets.
bag of tricks
Oh,
here.
good.
But a pellet is very small. It's about the size of a grain of rice, and you can show that one right here.
Yeah.
It can be implanted subdermally just below the skin surface, and it slowly releases testosterone over the course of 3 to 4 months, giving you very stable, steady blood levels, essentially replicating what your ovary should have been doing. And we can raise those levels back up to a higher level that brings about, again, change. Testosterone, again, being the hormone of desire, will make a big difference, again, on your psychological desire. And for women, that is a very important thing.
So Danielle, how long before, when you got this taken care of, did you start to feel a difference in just your overall energy?
Well, I swore I was like emailing their staff like 1 week later, like something feels different already. But I think, right around 2 weeks is where I just had this feeling like, oh, this is me.
Yeah.
I forgot who me is.
It's like I've got myself
like
back again.
energy.
I
Yeah.
just heard a
It's
quote the
just-
other day too from someone who said most people don't know how good their body is designed to feel.
Yeah.
You forget how good your body is supposed to feel because you just get into the groove of this like, well, I'm kind of tired. Oh, I'm kind of this. I'm kind of that, when there really are solutions. Okay, so there are more solutions too that Dr. Lisa offers, including Thermiva and the Mona Lisa Touch. We've talked about those before, but those are great options too when it comes to getting everything back on track in the nether regions. You know what I'm talking about? Okay, yes,
Yes.
you do. Okay, Dr. Lisa, thank you. During the month of February, Wayzata Cosmetic Surgery and Spa is offering several deals to help you take back the bedroom. That includes $300 off Thermiva and Mona Lisa Touch, those treatments. For all deal details, head to TwinCitiesLive.com, and a big thanks to Wayzata Cosmetic Surgery and Spa for sponsoring Twin Cities Live. More